There are a variety of depressive disorders. How do you help your patients appreciate if they have a major depressive disorder?
So the symptoms of major depressive disorder that I see in my patients generally include depressed mood most of the day, every day, and the period of time lasts for over 2 weeks. In addition to their mood being sad, they aren't sleeping well at night, or they're sleeping way too much. They don't have energy during the day, they're exhausted, their concentration is poor. They have difficulty concentrating on, perhaps reading a textbook or reading a newspaper article. They might get to the end of a paragraph and not remember the first sentence or two.
Yeah, and they have problems with their memory too.
Absolutely, because they have trouble concentrating and focusing and attending. There's a great deal of hopelessness and helplessness associated with major depressive disorder. Changes in appetite. Some patients lose their appetite and lose weight without trying to. Some people will eat too much and gain weight as a way of trying to comfort themselves. And I think the most concerning symptom in major depressive disorder is that oftentimes patients start thinking about death or even suicide. And that becomes, the most dangerous aspect of major depressive disorder, when someone contemplates suicide, creates a plan, or even makes an attempt.
Yeah, and you could think of suicidality as a continuum where someone might have a fleeting thought, or they might, in a more serious way, think about it a lot or obsess about it. And if it gets more serious, they might act on it. And that could be in the form of a gesture, whether it's a cry for help, but also even that's a serious kind of acting out behavior of the suicidal need or desire. And then, of course, the most serious kind of suicidality is suicidal attempts, where somebody actually tries to kill themselves and wants to die, and for some fortunate reason that they didn't anticipate, they're rescued.
Right.
If anyone who has suicide gestures or suicide attempts is a serious suicide risk their whole lives, essentially, if they have major depressive disorder, right?
Absolutely.